Okay, you can start.
Okay, hello everyone. Welcome to today's shadowing session. We have with us Dr. Biyani today. He's going to be teaching us about his dental journey and his work as a dentist. And so you can go ahead and take it away. And thank you for joining us today.
Brilliant. Thank you very much for having me. I hope everyone's okay. I'm Dr. Biyani or Prateek. Just to give you a small introduction, that's me. I qualified in 2016 in the UK, and I do a couple of jobs which I'll come on to provide me with what's called a portfolio career. So I have a mix of jobs that I do, and those are just the qualifications that I've done along the way. So very, very quickly, the things that I'm aiming to hopefully cover over the next hour or so is my journey all the way from applying to dental school, the process of applying to dental school in the UK, and then what I've done afterwards in terms of jobs, experience, and what I do today. Within that, along the way, I've worked in hospital, and I still work in hospital. I've worked in dental practice. I'm also going to talk about NHS dentistry, which is something that in the States you may or may not be familiar with, but it's a very hot topic, particularly in the UK at the moment. And I'll discuss mostly the bad things related to it, but why people feel that way about it. And I'll also talk a fair bit about beyond clinical dentistry. Whenever we think about dentistry, we just talk about being in clinic, treating patients, but there's so much beyond that within dentistry, and that's a fair bit of my time's involved with that. So I'll also talk about that as well. And obviously any questions, anything like that, feel free to ask whenever. So the first thing was deciding on dentistry. So in the UK, we have to make this decision around about the age of 17. And that's when we're in our last couple of years of school. And we set ourselves up just before we start the last year of school. That's when we apply for university. Just before that, we make the decision what we want to do, because then our last year of school is targeted towards that application. So the way the applications work for dentistry and medicine in the UK, you start your application around about October time. You submit what's called a personal statement, which is one side of A4 paper that is basically why you want to do the career that you've chosen. So why you want to do dentistry or why you want to do medicine. So ideally by this point, you will have done some work experience or work shadowing like this and gained some more experience in dentistry. So you put that all down on a piece of paper, and essentially you're selling yourself to the universities as to why they should pick you. From that, you then get offered interviews if the universities like you. And then eventually, after the interviews, if they like you enough, they'll give you offers. There are a couple of small caveats and catches to how the system works. So you can only apply to 4 universities that offer that program. So you could apply to a maximum of 4 dental universities, and then you can apply to a 5th one, which is something non-dentistry. So that's what we often refer to as a backup option. So it's usually some other type of science degree that you can go on to, so that in the future you can apply for dentistry again, and that degree is still relevant. So for me, there are a couple of reasons that I chose dentistry. I come from a family of medics. My dad's a medic, my sister's a medic, my brother-in-law's a medic. So I've had a big influence of medicine in my life, but there were some really important differences between medicine and dentistry, and that's a very, very common interview question in the UK as to why are you applying for dentistry and not medicine, because they can be quite similar. So one of the big things which you'll see through this presentation is the variety and the flexibility you have in dentistry. If I wanted to just work half a day in dental practice, I can, and I can spend the rest of my week doing something else in dentistry. Or I could teach one day a week and I could work in practice 3 days a week. One of my colleagues that I work with, he works in practice 1 day a week, he works in hospital 2 days a week, and then he teaches 2 days a week. So it's a very varied career, and it means that you're less likely to get bored with what you're doing, and you're continuously seeing something new. The other thing with dentistry, particularly if you're working in a normal dental practice, is you're responsible for everything. So it calls on multiple skills. You have to take a history from a patient. You have to diagnose a patient and do the investigations, x-rays, all of those things. You have to interpret those investigations. You have to do the treatment. So you have to do surgery or restorative treatment. And amongst all of that, you still have to be able to communicate well with the patient, look after patients, deal with upset patients, angry patients. So there's lots of skills, whereas in certain careers, you might, for example, if you're in medicine and you just became a radiologist, you would spend most of your time just looking at images and reporting on them. So you wouldn't deal with the other skills, which in dentistry you get to do. You get to see a wide range of these things. And the other thing is the range of patients that you see. Again, I compare a lot to medicine, but if you're, for example, a cardiologist, you would tend to see a very, very specific age group. So there tend to be middle to late aged, some history of heart problems. You won't usually see really young people. It's quite rare to get, out of that small age group. But with dentistry, you see everyone from the smallest baby to the oldest adult and everything in between, with all different medical backgrounds, different ethnicities, different demographics. There's everything involved. And that means that, again, you're challenged with different things, you experience different things, but also you get to build long-term relationships with these people. I work in hospital, and like I said, I'll come on to that. But one of the things I don't like about hospital is I often see a patient for 1 or 2 appointments, and that's it. Then they're discharged, they're out of my care. Whereas in dental practice, you see them every 6 months, every 12 months, whatever it is, and you can build that relationship with them, that rapport with them. That's when patients trust you and they'll come to you when they've got problems, and it becomes much more friendly in the approach. So coming on to my personal application for university, UCAS is just the system that we use here. So it's the University and Colleges Admission System. And like I said, you can apply to 4 universities. So I applied to, if you're familiar with the United Kingdom, University of Leeds, Sheffield, King's College in London, and Barts in London. And from there, I got 4 interviews and I got 3 offers in terms of going to study dentistry. So the decision I made was to go and study at the University of Sheffield, which, to orientate you, there's a map of England, mainly England and Wales. The red star is London, the blue star is Sheffield. So Sheffield's more in the north of the country. And ultimately, when I came to my decision-making of where to go for university, I was torn between Sheffield and King's College London. So on its own, being in London, there's something that comes with that you're in the capital of the country. You're going to have lots of resources there, lots of people. It's going to be a good environment for a student just to develop in. So there are lots of factors that affected my decision. And it's important when you're choosing where you're going to study that you don't just think about, what student life is like or what's the nightlife like. There are lots of factors that are really, really important, because these types of degrees, they're not short degrees. They require a lot of commitment. So, in times when I was in university, I'd be spending weeks studying for my exams, where my friends who were doing other degrees would be out partying every night, or would be going to, to gigs or whatever it may be. And I didn't have the opportunity. And so what I was doing in my university, and my actual university rather than the city I was in, became quite important. So one of the things that I really focused on was the teaching style. In the UK, and it's similar around most of the globe, there are 2 main teaching styles for universities. There's lecture-based teaching, which is kind of the traditional, you go to a lecture theatre, there's a lecturer at the front, they talk for an hour and a half, and you just take notes, and that's how you learn, and that's how the degree goes. But there's also another type of teaching style that's known as problem-based learning, or PBL. And that's different in the fact that generally you're put into small groups. You get given a topic or a subject, something to read up on, and each of you within that group, you go away, you do some research, you then come together and you share that knowledge. I personally don't like that method of teaching, particularly when you're early in your university career, because if you're in a group that not everyone's going to go and do the work they need to, you're at a disadvantage, and you end up doing a lot more work than you should be doing in the first place. So I prefer almost a blended approach, which is what Sheffield gave me. So they do lectures for the first 3 years or so, and then when you go into your 4th and 5th year, dentistry is a 5-year degree here, you end up having more problem-based teaching where you have more knowledge, so you can apply those to problems you're given. Another great thing that Sheffield University, and it's the only university in the UK that offer this, is we do cadaveric dissection. So a lot of dentists think anatomy isn't important, but actually anatomy is so important, because when you then go and do clinical skills, whether it's taking teeth out, whatever it may be, knowing that basic anatomy is really, really important. And so in University of Sheffield, in the first year, when you learn all those foundations, you learn that basic anatomy and physiology, we actually have cadavers of people who've donated their bodies to science. We directly dissect them. We learn a lot more doing it hands-on. Other universities tend to have something that's called prosection, which is where everything's already dissected. You might have seen them. They're almost like little models that you can get. And they're good for learning, but by actually physically doing it yourself, like with any other skill, it's easier to learn how to do a filling by doing it rather than watching someone else do it or seeing a picture or something. So by doing the dissection, you appreciate things a lot more. So that was a big deal for me in terms of choosing between King's College and also between Sheffield. Location, just generally from a personal point of view, was a big deal for me. I didn't want to be too far from my family. My family are about an hour's drive from Sheffield, but they would be 4 hours drive from London. And I've never lived in London either. So for me, I've always lived in relatively small cities. To go to somewhere like London, it might be nice for a couple of weeks on holiday, but living there for 5 years, if I didn't like it, that would be a very, very long 5 years. And then finally, cost. Ultimately, as a student, cost is very, very important. I know for you guys in the United States, cost as a student is a big thing, and your student loans are very, very big. Comparatively, they're quite small here, but just general cost of living is an important factor. Sheffield is significantly cheaper than London. London being the capital, obviously prices are a lot higher, but I remember going on open days to the universities there, and the accommodation that I would get in London was nothing compared to what I get in Sheffield. It was, my room in Sheffield in my university accommodation was about 4 times bigger than my London equivalent. So that kind of goes through what influenced my decision. So like I said, I graduated from Sheffield 6 years ago now with honours. And then since then, I've done a couple more qualifications, essentially to strengthen things that I've already got, and also to back up, as you'll see shortly, things that I do at the moment. So I have a really big passion for teaching, and I'll show some of the projects that I'm involved with. A lot of the qualifications that are on this slide are related to teaching. So the first one is the MFDS. The MFDS it's almost like sitting your dental finals as a postgraduate. So most dentists will do it within the first 2 years of graduating from university, and it basically shows that you've gone the extra mile, done a bit more learning, and it just is an easy qualification diploma to get. It's also a requirement for specialty training in this country. So if you're choosing to do any type of specialty training, one of the points on your application is if you sat and passed that exam. It's an exam of 2 parts. You do a written exam and then you do an acting-based OSCE exam. Then I've done a certificate in medical education. Like I said, it's a big part of what I do. I do education within my job. I also do it outside of my job. And so having that extra qualification almost has a bit more weight behind what I do. But again, having other qualifications for specialty applications becomes important because you score more marks if you have other qualifications. From my certificate in medical education, there is something called the Higher Education Academy here, which is essentially an association for people who deliver teaching, for educators. And they provide resources, they provide support for educators so that they can improve what they do. So I applied to become a fellow within that. And so that was about 2 years ago I did that. And then most recently, about 6 months ago, I applied to become a member of the Faculty of Dental Trainers. And that's with the Royal College of Edinburgh. So one of the Royal College of Surgeons in the United Kingdom. And it's a similar concept. It means that now I'm involved with dental exams that are sat, such as the MFDS. I can now examine on that. And also other educational events and courses that they run. I can take part in those. And so that is essentially kind of carrying more weight to the work that I do at the moment so that people believe what I do essentially. So the next thing that I did after qualifying from university, I did dental foundation training. Now in the UK, there's a very, very strong, like I said, there's the National Health Service, very strong government-based dental system and dental care system. There is also private dentistry, and private dentistry, as you'll see shortly, is becoming more and more common, and a lot more dentists are shifting to private dentistry. But in order to work on the NHS and to be registered on the NHS as a dentist, you have to do something called dental foundation training, and most people will do that following their graduation, essentially. You can choose not to do it, but if you don't do it, you can't work on the NHS. So you can do private dentistry, and you will still be registered with the General Dental Council because you just have to pass your exams for that. But if you want to provide NHS care, you have to do foundation training. To apply for foundation training, basically what happens in our final year of university, amongst all the exams and everything that we do, we sit some interviews, which are standardized across the country. So 900 odd dental students in their final year will all go to these exam centers. We do interviews, and then we get ranked against each other. And depending on how we rank, we get given jobs across the country. So I wanted to do it because I wanted to work on the NHS. And I went to a practice in a a town called Halifax, which on the map, again, to orientate you, is the green star. So not too far from Sheffield, about an hour's drive from Sheffield. And foundation dentistry is essentially, it's almost to bridge the gap between dental school and becoming a fully fledged independent dentist. So it's a supervisory role. I put kind of quotes behind that in the fact that you don't have someone stood there over your shoulder whilst you're treating patients. They're not watching everything that you do, but you have someone essentially in the room next door, another dentist who will be responsible for you. So they're your educational supervisor is a term that we use. And it means that you have a safety net, or if you're stuck with something, you have someone to turn to, which, you know, if you just qualify out of university and you get put straight into working in practice, which we're finding at the moment with some people who qualified through COVID, you don't have the confidence. You haven't dealt with patients on your own, and there'll be a lot that you don't know. Even me, 6 years on, there's so much I don't know. So within this first year, having someone supervising and someone to turn to means you have a support network, and you don't have to think you're alone dealing with problems. So this educational supervisor is essentially attached to you. It has to be someone who has a certain amount of experience. So they themselves go through a rigorous application process to become a supervisor. And it also means that the practice that you're working in, the dental practice you're working in, has to provide certain things. So the practice itself also gets assessed to make sure they're providing equipment, materials, a support network, nurses that are appropriate for you. And then, as well as providing dentistry, you also have a portfolio that you have to maintain. So you will have assessments you have to do, you'll have cases you have to present to your supervisor and other supervisors, you'll have audits you have to do, and all of these are, again, skills that are aimed to develop you as a clinician, but also to go and help you if you want to apply for specialty training. So within this foundation year, you essentially do general dentistry. So you're doing fillings, you're doing root canal treatments, you're taking teeth out, you're doing normal basic dentistry. But because you're in a supervised role, it means you can push yourself a little bit. You can go out of your comfort zone because you've got the safety net. So, you know, dental schools will teach you a certain way of doing dentistry, and then you go out, work in the big wide world, and you realize that's not how you do dentistry. And you learn all these new skills, all these new techniques, and foundation training is the time to use them because you've got someone working with you. And it also is helpful because a lot of the patients are aware you're a foundation dentist. So they're aware that you've just qualified, and they know that things are going to take you a bit longer. So that means you can spend time, you can build up your skills, you don't have to rush things, you don't have to feel pressured. So an example, the pictures on that slide are a patient that I saw. In fact, it was a patient I presented as my kind of finals patient in that year. The lady was really, really anxious. She had really bad gum disease. She needed some teeth out. She needed lots of fillings doing. And it wasn't anything particularly complex, but it was a nice result at the end of it. She was happy. And it was a really nice thing to present as well, that I've taken this patient through the year and gradually got her dentally fit. The other thing with foundation training is that it's a salaried job. So dentistry generally in the United Kingdom is a self-employed job. So you're not paid a salary, you're paid depending on how you work, which is what it's like in most of the world. But foundation dentistry is salaried. So you are paid roughly around about £32,000 for your year. And that's regardless of how much work you do. So that's the other aspect of that. You're not pressurized into performing a certain amount. You're not pressurized to see a certain number of patients, and you can spend time. You can have nice cases. You can work on your photography. You can spend time on your logbook, having lots of meetings with your supervisor, and you're protected with your salary. It also means you have a set amount of annual leave you can take. So you can take a certain number of days off, which we get quite a lot of in this country. You get about 6 weeks of annual leave through the year, which is a lot more compared to a lot of other countries. But you have that safety net, that you're paid regardless of what happens. So then that's your only compulsory year if you want to do NHS dentistry. After that, it's essentially a free-for-all. You do what you want to do within dentistry. So then I went on to do what's called dental core training. Now, dental core training is not compulsory, like I said, but a lot of people will do it in the UK. And it's basically a way of getting more experience in other specialties in dentistry. So generally specialties that you're not really exposed to in your undergraduate degree. So this things like oromaxillofacial surgery, proper pediatric dentistry, dental public health, restorative dentistry, like working with specialists, oral surgery, oral medicine, spending all your time within that specialty rather than maybe a week. And you can do up to 3 years of this. And you can do all 3 years in different specialties. So if you wanted to get a really wide range of skills, you could do 1 year in Max Fac, you could do 1 year in peds, you could do 1 year in restorative. And then you could go back and work in dental practice. And what that does, it gives you lots of skills you can then take back into practice, and you'll be more confident doing certain treatments. So it's all about gaining confidence and learning new things from particular specialties. So I really wanted to do it, and I'm a really, really big advocate of doing it. So I do lots of talks about dental core training in this country to younger dentists, and anyone who asks me about it, I always tell them to do it. So any method that you can use to get more experience is really big. Even before starting a dental degree, any experience that you can get, work experience, visiting places, visiting hospitals. A lot of people just think going to a dental practice is work experience in dentistry, but actually dentistry, as I'm showing you, is beyond working in a dental practice. There's so many other things you can see. So any opportunity you can take is worth taking. So I did my first year of this back in Sheffield. So I moved back to Sheffield, and I worked in that rather grim-looking building called the Hallamshire Hospital. And I did oral maxillofacial surgery. So in the UK, in order to be an oral maxillofacial surgeon, you have to do both dentistry and medicine. So you have to have both degrees. And the UK is one of the only countries in the world where that is a requirement to do Max Facs. But that's if you want to go later on in a career. So you want to become a consultant or, as you guys call it, an attending or whatever, that type of level of doctor. But to be a junior doctor, so a low-level doctor, you don't have to go and do medicine. You could just do dentistry, or medicine, and you can go and do these jobs. So we'd see patients who've had facial trauma, who've got cancer, who need orthognathic surgery. So that's to correct deformities. So people who are mid-brace treatment in order to move their jaws around. And again, it's a salaried job. So no matter what you're doing or how many days you attend, you are paid a fixed salary. That salary changes depending on doing on-calls. So some of these dental core training jobs don't have any on-call commitment. So you just turn up, you work 9 to 5, you go home. In that case, your salary is around £36,000 to £37,000. But if you do on-calls, you could be working days, nights, weekends, and that will increase your salary. So for me, I did all of those, and my salary was about £55,000 after taking the on-calls. But you work a hell of a lot. You work really, really hard. And when I compared myself to my colleagues who just went and worked in practice, I was working so much more than them and not getting paid anywhere near as much as them. But I knew I was doing it for experience, and I learned a lot from what I did. In this hospital, for example, after 10 o'clock, you have no one to call if you have an emergency. So when you're on a night shift and something goes wrong at 1 a.m, you have to make the decision. The pressure is on you, the stress is on you on making decisions, deciding on treatments. And you're essentially a doctor. So we haven't done a medical degree in the UK anyway. In our undergraduate degree, we do cover a fair bit of medicine. We have about nearly a year of our degree spent on medical things, but nowhere near what doctors taught. And, dealing with how to check a chest for any lung problems and those types of things. We don't learn that, but you have to learn it on the job. And it's things that you'd never think you would ever do. But I'm grateful that I did them, and I've learned those skills, because now when I'm working in dental practice, if I have a patient who's on 50 different medications, it doesn't scare me because I've seen far more complex patients. I know how to manage them, and it doesn't worry me. And again, there's some pictures there. That's a gentleman I saw who was using an angle grinder on some metal. It got stuck, it kicked back and hit his face, and we got a big laceration across there. So we put him together, and luckily, it went through what's called your nasolabial crease, which is a fold that goes across next to your lips. And so when, I don't have the follow-up image, but when we followed him up about 6 weeks later, that you couldn't see the scar anymore. And it's those types of things that you do. It looks really nasty and it looks like a big job, but you learn those skills, and really satisfying when you do those types of things. It's not something that you would do in a dental practice on your average day. The other thing with working in somewhere like Sheffield was that it's a big teaching hospital. So in the UK, we have a system called a wheel and spoke system, or hub and spoke system for how the hospitals run. And that basically means we have certain large hospitals that will take all the big cases. They will have all the big jobs. So, for example, London is one of the big centres. Sheffield is one. Other cities you may have heard of, Manchester, Leeds. They're all big hospitals. And there'll be lots of little smaller hospitals that will feed their patients to these big places. But what that means is in the big places, there is a lot to learn in terms of interesting cases, weird and wonderful procedures that are done. And so you can then go and present these. So I did a lot of poster presentations at conferences. I did oral presentations, went and presented lots of slides at conferences as well. And all of that's really helpful, again, if you want to go and do further specialty training or even work in academia. So you want to go and do research, anything like that. Doing those things is really helpful to bump up your CV, essentially. So I did lots of that within my year that I was there. I then thought I wanted to learn a bit more. So I got lots of hands-on work, but I didn't get lots of hands-on work in oral surgery. So I wanted to get better at taking teeth out surgically and learning other oral surgery skills. I learned lots of skills, suturing up lacerations, dealing with fractured jaws and stuff like that. But the actual nitty-gritty of what I would most likely be doing in practice, I wanted to learn more about that. So I decided to do a second year of dental core training at a smaller hospital, which is nearby, called Chesterfield. And in the similar to what I said, because it's a small hospital, any of the big complex things we'd send to Sheffield, and all the little things that were nice to deal with, we would deal with ourselves. So it meant that I was getting a lot more hands-on work of things that I'd be doing day to day, as well as still seeing some of the big things, but not having to deal with it, which is a really nice thing to be. So we'd still see trauma, but we'd only operate and deal with trauma on the odd occasion. We'd still see cancer, but we'd send them up to Sheffield for major operations where, they're cutting chunks out, putting bits of leg and things into your jaw. But we do a lot of minor oral surgery. So that's things like wisdom teeth removal, more complex dental extractions. But also the added benefit, it's one of the few centres in the UK that does sedation. So we do intravenous sedation with midazolam. I know in the US you use slightly different drugs for sedation, but we typically use midazolam here. And that's a really, really good skill to learn in the UK because not many dentists know how to do sedation. And it makes you very, very employable and very attractive as a dentist here. So again, a salaried job. On-call wise, I only had to do days on call. So I didn't get any extra money for it. I was on call 9 till 5 while I was there. But it meant I got my social life back. I could use my weekends and do things, which I couldn't do the year before because I'd be on call most of the time. And like I say, it's that smaller district hospital. So it meant that I learned a lot more and I got a lot more hands-on. Within 2 months of being here, I'd done more hands-on work compared to the year that I'd been at the last place. So then coming on to what I do now. So now I'm a specialty doctor in oromaxillofacial surgery, and I'm also an associate dentist in dental practice. So like I said, to do maxillofacial surgery properly, to higher levels of qualification, I have to go and do medicine, which I've toyed with the idea of doing, but it's a lot of work. So there's essentially a middle ground where you're not a junior doctor, you have more responsibility, but you're not going all the way to the top. And that's what's called a specialty doctor in this country. And then an associate dentist is essentially a normal dentist working in practice. I don't own a practice. I don't run a practice. I am not employed. I'm contracted. I essentially rent a room in another practice and I work there. So in terms of my specialty doctor work, I stayed on at the hospital that I did my dental core training second year at because they had a job available. So I do a lot of the same stuff, but I'm more responsible now. So I kind of teach the people that were in my position before. So I'm responsible for their care. If they get into trouble, I'm the person that has to get them out of trouble. I teach them sedation. If something goes wrong, if a patient suddenly has a medical emergency while they're being sedated, it's my responsibility to manage that. So it's important that I have the experience, that I'm able to do this, and I'm able to provide it. And we're kind of the gold standard centre in the entire country for this service. And like I say, I teach the DCT, so I run teaching sessions with them. All the stuff that I was taught as a DCT and in my training years, I now teach them. I also teach dental students because they visit our department, but I work quite independently. So I don't do any on-calls. I turn up to work for my clinic at 9 o'clock, and then I go home at 5 o'clock. I have very little stress or worry outside of work. I just turn up, do what I need to, and leave. Like I say, I do have added responsibility, but it's only to a limit. I don't have to get involved in any politics of hospitals. I don't have to deal with management. I just deal with things that affect me, essentially, and that's the end of it. It's a salaried job. So because I'm employed within a hospital, all hospital doctors, they're all paid a salary. So I work there 3 days a week, and I am paid for 3 days a week, which, I don't know, works out to about £36,000 for 3 days worth of work. And I'm currently working Saturdays as well, which I'm getting paid different for. But it means I am guaranteed that money regardless of whether I work or not, regardless of whether I'm off sick or not. This was really important, and I didn't appreciate it as much as I do now until the COVID pandemic hit. Because when the COVID pandemic hit, a lot of dental practices weren't paying dentists. Whereas because I was working in a hospital, I was still getting paid. And this was enough to cover my bills, cover my life, whatever I needed. That was enough to cover me. The disadvantage of working in a hospital and it being a salaried job is, like I mentioned earlier on, when I compare the work that I'm doing and the time that I'm spending to my colleagues who are just working in dental practice, I'm earning less. So I could be earning more within practice, but I'm choosing not to. And one of the big factors of that is there's significantly less stress. I'll touch on it again later on, but the UK is this. I think Israel is number one for litigation and complaints for patients and dentists being sued, and the UK is number two in the world. The culture of patients suing dentists and putting complaints in against dentists is really, really bad here. And you could be the most ethical dentist in the world, and you will still get caught out. The nice thing of working in a hospital is I have a huge group of lawyers protecting me. Complaints come in. Thankfully, touch wood, not many, but when they do, I know I'm protected. I know I don't have to worry too much about it. And if something does happen, I just give a statement and that's it. I don't have to get involved more than that. It doesn't cost me anything. Nothing goes to court. I'm not paying loads of money. Working in dental practice, you don't get that protection. You have to have what's called indemnity providers in this country, which is essentially they protect you. They're designed to protect you. But a lot of them, it's too expensive to protect you properly. So they will just pay patients what they want. So if a patient is suing you because they think you've done the wrong treatment, even though you haven't, it is easier for these providers to pay the patient the money and end the thing there rather than take them to court because they're lying or whatever it may be. So being in a hospital, I don't have to worry about that as much. I'm protected. I pay less to an indemnity provider because I'm hospital protecting me 3 days a week, which is a very, very nice environment to be in. But like I said, I also work in practice at a dental practice in Sheffield. That's the surgery I work in. And we are what's called a mixed practice. So we provide NHS care and we provide private dental care as well. And it's under private ownership. So in the UK, we have a few corporate dental companies. So they own hundreds of dental practices and they're run by big corporates that have a head office somewhere and dictate how things are run. Whereas the practice I work in is an independent private ownership. So there are 3 people that own this practice and another practice. And it means we have more control over what we're doing. We're not dictated by a head office. If I want something, I just go to the owner that I want it and it's ordered for me without much disagreement or argument. So we provide a mix of NHS and private care. But the difference here, like in any dental practice here, is I'm not salaried anymore. I get paid based on what I work and what I do treatment-wise. So that means if I decide to take 5 weeks off to, go on holiday, I'm not earning for those 5 weeks. And that will obviously have an impact on what I take home at the end of the month. So those things you have to consider when you're balancing these things. The reasons I like working in this practice, and these are factors that I looked for really, really closely when I was searching for a practice. I was very, very picky with where I was deciding to work. And in fact, I've worked in one of the dental practice before this and absolutely hated it. And a lot of what I learned in terms of deciding where to work came from that. So I've got a very, very supportive team around me. And like I said, the owners. It's very much an ethos of the dentists need to be happy. So if I turn up to work and the materials that I need for a particular procedure aren't there, I can get annoyed about that, and that's fine. The nurses won't be worried about it. The owners won't be worried about it because I'm legitimately annoyed about it, and they will do whatever they can to rectify it. If I decide that I want to order some new materials or something to just try, I can order it. The questions aren't asked because ultimately the owners realize that I'm going to try and provide the best care to the patients. There are a lot of other dental practices where this isn't the environment. So I know colleagues who will want materials, whether it's filling materials, whatever it may be. They ask for it and they wait 6 months, 8 months, 12 months to try and get the materials. And there'll be lots of difficulty in trying to justify, well, why do you want to use this? It's costing too much, etc., etc. And they'll just be given the cheapest thing possible. I'm grateful, I'm lucky, I'm not in that environment. It doesn't matter how much it costs. As long as it's justified, it doesn't matter. I've also got a very supportive group of dentists I work with. So I work with 4 other dentists. And that's also really important because, like I mentioned, patients sue dentists readily in this country. And a very common reason patients sue dentists is they go and see a new dentist. And when they see the new dentist, that dentist will comment and be like, oh, this has been missed on your x-rays, or that treatment's not very good. And that means, obviously, the patient will be like, I can get some money here, they'll go and sue you, they'll put complaint in, whatever it may be. But having a supportive group of dentists working within the practice means that if one of my patients happens to have a problem and turns up to see one of my colleagues, they will have my back and they won't say that treatment I've done is wrong, or they won't put me in trouble. They won't make it so that the patient's wanting to complain. And it's a really big deal. Again, historically, having been with colleagues that aren't like that, it makes such a difference because I'm not as stressed. I'm looking over my back all the time, worried about what other people may say. The other reason I really like to practice is I have room for development. So my skills of doing sedation in hospital, I'm now wanting to introduce to this practice. They don't provide sedation. And like I said, sedation is a rare attribute for a dentist to be able to provide. And so there aren't any dental practices in our area that actually provide it. So it would be a very lucrative thing for the practice. We would get referrals from other places. And I can see room for development for me within the environment that I'm in. And also because I have a very good oral surgery background and I can take teeth out quite easily, I get referred patients from my colleagues within the practice who aren't very happy to take teeth out. So all those skills that I learned before are now all starting to come together and kind of show their head in terms of what I can benefit from them and skills I can bring to places. And one of the things that when I went to interview at this dental practice was, they saw that I do sedation, they saw that I had these other skills, and they saw that that's something unique that I can bring to the practice and provide them, because they've already got a dentist that does cosmetic dentistry. I think every dentist does cosmetic dentistry at the moment, and does lovely composite bonding and orthodontic treatment, all those fancy things. But not many dentists do the other stuff. So it makes it very, very nice for practice to see someone else provide those skills. So that's kind of what I do, my journey of work, and I promised I'd go through what NHS dentistry is. We're good for time at the moment. So NHS dentistry is wonderful. I'm a big advocate for the NHS. I work in the NHS in hospital. I think, and I'm sure you guys in the US probably would love a really nice government-based healthcare system. We have free healthcare at the point of service, which is wonderful. You can go to a hospital, have whatever problem, and get treatment for free. The NHS is a slight exception to the rule. NHS dentistry isn't completely free. NHS dentistry is free for certain people. So, for example, from low-income backgrounds. But for the average person, if I wanted to become an NHS patient, I would have to pay money. However, I pay a very, very small amount, and it doesn't match up to the work that is done. And the slide kind of covers some of the headlines that have just been in the news here in the last 2 to 3 months. And it just shows that NHS dentistry is a dying part of the NHS. Through COVID, dentistry stopped in this country for the best part of a year and a half. And that means that now dentists, and I'm experiencing this myself working in practice, we have a huge backlog of patients that need treatment, appointments that need booking. But we don't have the time. We don't have appointments available. We don't have dentists. Something like 3,000 dentists left the NHS during COVID and after COVID, partly because of this problem. You have patients coming in who need so much treatment, and it's not, as you'll see in a second, it's not worth doing it on the NHS. And so many people have left NHS dentistry. It's more stress than it's worth. So to kind of break down NHS dentistry, like I said, it's a broken system. It used to be very, very good. And it used to be comparable to hospital work, even though patients used to pay slightly more. I guess patients are more accepting of it. But over time, NHS dentistry hasn't kept up with changes in lifestyle, changes in demographics, changes in patient habits. And so it means that it's lagging behind, and it's now got to a point that it's too late to fix it. And this is an issue that's been going on, to be honest, for the last 5 to 10 years. But COVID is something that's essentially broken it completely. So the way NHS dentistry works is we have something called units of dental activity, or UDAs. And what happens is The dental practice, or the practice I work at, the NHS will give them a certain number of UDAs to do. So just for the sake of it, we'll say the dental practice is given 20,000 units to do within a tax year, so April to April. And then what the dental practice will do, they will take that 20,000 and they will then divide that amongst their dentists. So I agreed with my practice owner how many UDAs I wanted to do within a year. So I only work there 2 days a week, so I agreed to do 2,800 UDAs. And then the other dentists, depending on how much they work, they will decide to do a certain number of UDAs. And ideally, between us, we cover those 20,000 so that we can complete our contract, basically, because it's a contractual agreement with the NHS that we will deliver this care. And I will get paid a certain amount per UDA that I do. So again, for simplicity, you could get paid £10 a UDA. So basic maths, if I'm contracted to 2,800 UDAs over 12 months, I get paid £10 per UDA. I would theoretically get paid £28,000 from my dental practice for my dental work if I meet my target. That, however, is before paying tax, and that's before any tax, and before paying things like your lab fees or if a patient hasn't paid for their treatment. So inevitably that value drops. So that's kind of how a dentist is paid. You have an agreement with the practice that you will provide a certain amount, and for that amount, you will get paid a certain amount. The way the treatment works on NHS is it's divided into 4 bands of treatment. So you have band 1, that is your basic care. So that is your basic dental checkup, x-rays, and a really basic clean. So not much is included in a band 1. And for that, as a dentist, I would get 1 UDA. So I would essentially get £10. Then you have band 2. Band 2 is more of the slightly more complex dental care. So things like taking teeth out, doing fillings, doing root canal treatments, fixing broken dentures. Those all come into band 2 course of treatment. And so that would mean for 3 UDAs, I would get £30 for a band 2 course of treatment. Then you have band 3. That is essentially any dental care that involves a lab. So making a crown, a bridge, making a new denture, making a mouth guard, something like that. And I'd get paid 12 UDAs. So I'd get paid £120. And then you have band 4. Band 4 is essentially an emergency band of treatment. So a patient turns up, they've broken a tooth, something like that. They need a quick patch up. You get paid 1.2 UDAs, and that's emergency. The problem with this system is it doesn't matter how much treatment a patient needs. So if I see a patient, they come in for a checkup, and they need 10 fillings. They will just pay for a band 2. And for all of that work, I will still only get 3 UDAs. I won't get 1 for the checkup and then 3 for the treatment. I won't get 3 UDAs for each filling I do. I will just get 3 UDAs, which on the next slide, you will see why that is a major, major problem. Also, what the dentist gets paid is different to what the patient pays. So for example, for a band 1 course of treatment, like I said, based on the numbers I've got on the slide there, I would get £10. The patient would actually pay £23. For a band 2 course, the patient would pay £65. And for a band 3, a patient pays about £288. So it's very different to what the dentist is actually getting paid. And that's, again, a very common misconception amongst patients here. When they're paying, they're like, oh, this is just so that you can drive a BMW, whatever it may be. But that's never the case. The dentist doesn't get what the patient's paying. And the other thing is, because it's a contract between the NHS and the dental practice, if I don't meet my target of 2,800 units by the end of the year, I have to pay money back, because the practice will have to pay the NHS money back because they've breached their contract. So it's really important that you work to your target and you achieve that target. That's something that's referred to as clawback in this country. So they'll take the money back from me because I've not met my target. So you can start to see how this doesn't work as a system and how it's a lot more stressful compared to working in a hospital. But just to illustrate what I meant about earning. So this is just a comparison. If I had a patient that turns up, they just need 1 filling. So I see them for a checkup, they need 1 filling. I will get paid band 2, so that's 3 UDAs. So the patient will pay £65.20. These are actual numbers. So this is based on something that I did, patients that I saw. So the patient I got paid 3 UDA, so that I get paid £11, or this time I used to get paid £11.50 per UDA. So I spent about 40 minutes to do the checkup and do the filling for the patient. That made my hourly rate about £51.75, which is not that bad. But I then saw a patient who needed 10 fillings and a molar root canal treatment, which takes considerably longer treatment-wise. That's still a band 2 because band 2 includes fillings, it includes root canal treatments. The patient still only pays £65.20. I still only get 3 UDAs, £11.50 a UDA, but it takes me significantly longer, 300 minutes, for example, to do the treatment and do the checkup. So that drops my hourly rate to £6.90 an hour. And I've got other cases where I'm earning less than £1 an hour doing someone's treatment. I could be earning more working in a shop or, not working in dentistry. And this just illustrates why people are leaving NHS dentistry. It just isn't, particularly after COVID, it's not economically viable for a lot of people to be working in the NHS. And after COVID, because virtually every patient I've seen needs so much treatment, it's really, really difficult to actually earn a living. Along with that, more and more patients are on the waiting list. They're waiting months and months and months for treatment. So by the time you see them for their checkup and then they come back for treatment, it's been about 4 or 5 months. They have a new problem. And so you're endlessly treating these patients all for the same cost. You don't get extra money when these extra appointments come up. Basically, the way it works, you do your treatment and you submit what's called a course of treatment. That's sent off to the NHS. But you have to complete all that treatment before you can submit it. So if I see a patient for a checkup today and I don't do their treatment until 4 months from now, I can't submit that and I can't get any money. So it means if the patient comes back with more treatment, that just keeps extending the treatment that they're getting. And it will take me 6-7 months to get any money for that patient. So it's a really, really broken system, and it's pushing people more and more towards private dentistry, where you get paid for the work you're doing. So you get paid what's referred to as fee per item. So depending on what you do, you get paid that amount. And in fact, just yesterday, some changes were announced to the NHS dentistry system, but they just paper over the cracks. They don't actually fix anything, and it won't stop people leaving the NHS. So that's kind of doom and gloom of the NHS. Now on to beyond clinical, working within 4 walls of a clinic, and other things that I do outside of normal clinical dentistry. So all of these projects are basically education-based projects that I run outside of dentistry because of the passion that I've got for education. So the first one is a website called Dental Notebook, and this is a website that I started in the 2nd year of dental school. I got a bit lost, to be honest, during my dental degree, and in the 2nd year of dentistry, I had a bit of a stumble, and I was like, is this actually for me? And I thought, I need to apply myself more to what I'm doing and see, do I enjoy it? And that led to me starting this website, which is essentially a revision website for dental students and also dentists. That has revision notes, it has resources, it has other websites you can check out, it has reviews of books and things that you may want. And that's a project that I still run. It's nearly hit 1 million views, actually, at last checking. So it's grown quite steadily for the last 8-9 years. And that took a lot of my time up initially. It now has a YouTube channel, so I do educational videos on YouTube. And it includes also how to apply to dental school. So types of questions you can get asked in interview, how to write personal statements, how to develop yourself and get work experience, those types of things. I then wrote a book. So about 3 years ago, I had some time set aside and I self-published a book on Amazon. And then during COVID, I thought I'm going to submit it to a publishing house and see whether someone, an actual publishing house picks it up and gets it published. So there's a very famous scientific publishing house, Wiley-Blackwell, which is world-renowned. They liked it, they wanted to publish it, and again, it's an educational book. It's to help people prepare for dental school exams and postgraduate exams as well. So they published it worldwide January last year, and that's just a picture of me having come across it in a random bookstore in London. So it's available in America, it's available everywhere, and again, it's just a nice thing that it's nice to see that I've spent all this time learning these skills and developing my teaching, and to actually put that into a book for other people to then come to me and say it's been helpful. Is really, really rewarding at the end to do. And the last thing that or the most recent thing I should say that I've worked on is an exam platform. So I published my book and then I thought, this is annoying. I can't change it. I can't update it. I can't add questions. I can't do anything with it. It's there on a shelf, but I can't change anything. So then the middle of last year, I was isolating with COVID, and I thought I'll start a website, an education website where students and pre-dental students have access to questions, and they have question banks, hundreds of questions they can access to help them prepare. This isn't a platform that's available for dentists generally. So medics have lots of these types of platforms. A lot of medical schools in the United Kingdom offer students access to these types of platforms, but within dentistry, this didn't exist until I started one up. So it's essentially trying to become a one-stop revision and interview preparation. So we tutor people who are applying for dental school, such as people watching this. We tutor people through dental school, helping them with exams, helping them prepare, acting scenarios if they're doing an acting exam, those types of things. And we also help people with their written exams. So like I said, there's hundreds of questions on there. We continuously add them. There's me and two other dentists now to provide quality, validated questions online that people can freely access. But we also, tutor people later on in their careers. So people who maybe have a career crisis, they want to change what they're doing, career coaching, those types of things. And it's just a new thing for me to be doing and a new way for me to apply the skills that I've learned. So I do lots of Zoom sessions with people. And this is now eating into the work that I do clinically. So I spend more time on this in the week. This evening after this, I'll be spending a couple of hours doing stuff for the website, helping other candidates through their application processes. But it means that for me, I have a very varied week. I do clinical work, I do teaching, I like a lot of technology stuff, so I do a lot of technology related things. I write questions for the website, I do one-to-one tutoring. So I have a full range of things that I do, which I know that if, for example, I just worked as an associate dentist in a dental practice, I'd be quite restricted. And if I went and did medicine, I wouldn't necessarily have the time to do all of these things or have such a varied career. So that's everything that I've got. I'm happy to take any questions if there are any.
All right. Thank you so much for that presentation.
No problem.
So we do have some questions. So someone is asking what kind of stats allowed you to gain admission into dental school? You would be willing to share.
What kind of what, sorry?
Statistics.
So, okay.
Assume, yeah.
Yeah. So the systems work differently in the UK and the US, obviously. So here, when I apply to dentistry, we have letter grading through school, because we don't have, correct me if I'm wrong, but you guys have like preclinical years and you have, or pre-med type things where you do essentially an undergraduate type qualification before dentistry, don't you? Whereas here, dentistry is our undergraduate qualification, so we go straight into it after school. So within school, we have what's called A levels. So you have up to year 11 of normal school, and then we have college or 2 additional years called sixth form, and that's when you do your higher learning, you do your extra qualifications. It's not compulsory to do those years. You only do those years if you want to go to university. So you do those A levels, and you have to do certain subjects to get into dentistry. So you have to study chemistry, and you have to study one other science, whether that's biology, physics, or maths counts as a science here, and then another subject, basically. So you have to do a minimum of 3, and you have to get a minimum grade in those 3. So when I applied, you had to get a minimum of 3 A's. A star used to be the top grade when I applied. So A was just under that. Now you have to get 3 A stars. So you have to get the top grade. So it's very, very competitive, and you have to basically perform the best you can in those exams in your school so that you can then apply. If you don't get the grades, you don't even get interview. You don't get, it's one of the first things that universities will use to filter candidates out.
Okay, thank you. And then they're also wondering whether you think that 500 shadowing and volunteering hours and 350 hours are competitive for dental school.
So yeah, in my experience, the more you do, but not necessarily the number of hours, but the more varied experience you do, the better it is. So here we have a minimum of 2 weeks work experience or shadowing. The thing is, though, because these types of careers are so competitive, everyone's going to do 2 weeks. I have lots of people, ask the same question: how much work experience do I need to do? How much shadowing do I need to do? Never look at the minimum. Never think that, oh, everyone's doing this much, so I'm just going to do this much. You need to think, how are you going to stand out? How are you going to be different to the other candidates? So whatever you can do that is different will help. So, for example, when I did my work shadowing, I did some in dental practice in the UK. I did some in dental practice abroad. I did some in hospital in MaxFac. I did some in medicine, because then I could say why I didn't want to do medicine, because I had experienced medicine. So I had that to compare to. And I also went and did just a couple of days in a dental lab, just looking at how crowns and bridges were made. And that just meant I had a lot more to talk about on my, that personal statement thing that I had. And even during interview, I had a lot more that I could refer to. So the more you do, the better. And I definitely wouldn't look for a minimum. I just try to get as much as you can so that you can just show that you've tried showing your commitment and you've got some experience.
Okay, definitely. That makes sense. And kind of talking more about like your dental journey. So what do you think is the reason that you chose to try to specialize in like oral maxillofacial surgery?
I love surgery. It's it out of everything in dentistry, it attracts me the most. I just think, you go from the most intricate bits of surgery to the more complicated things. And the other thing with maxillofacial surgery is it's an integration of dentistry with medicine. So I deal with a lot of complex patients. And it adds a new challenge to the work that I do. So I don't do any, obviously, normal dentistry in hospital. I just do surgical dentistry. But just taking out a really simple tooth on someone who's had a heart attack 2 months ago and, who's got whatever medical problem, it's a completely different challenge. And the opportunities as well that I get in hospital, so doing the teaching, doing the sedation, is not something readily available in practice. And I like all of that stuff. So having that association through MaxFac, being able to teach the skills that I've got in surgical stuff to juniors is a really nice thing to be doing. And I just find the surgical stuff far more satisfying and interesting. Basically.
Cool. All right. Well, I think that's all the time we have for questions. Again, we want to thank everyone for joining us for today's session and for also presenting to us today. We really appreciate it.
No problem. There's some contact details there. Sorry, if anyone wants to get in touch, they can feel free to email me or whatever it is.
Okay, awesome. So yeah, we can end the live stream here. And thank you all for joining us.